Australia will fund healthcare programs across the Indo-Pacific under a $620 million boost to help build systems back up and support regional security. Foreign Minister Penny Wong, who is in Fiji for a Pacific Islands Forum Leaders Retreat, announced the new 5-year commitment for countries in the Pacific and Southeast Asia. The bulk of the program will support disease prevention and control, from vaccine research and development, to the prevention of non-communicable diseases, including diabetes and cancer, over the next 5 years. Sexual and reproductive health and rights programs will receive $157 million for measures to prevent and treat sexually transmitted infections, puberty education, family planning and respectful relationships. There will be $53 million to support the resilience of health systems battered by the COVID-19 pandemic. Senator Wong said health resilience was key to regional security and stability. Health outcomes in other countries matter to all of us, they matter to those communities, to national economies, and they matter to regional stability, she told reporters on Thursday. We saw during COVID-19 a lot of health resources diverted to meeting challenges that the pandemic presented, and that often came at the expense of underlying health systems. The new health funding comes as China steps up its presence and influence in the region. Senator Wong said it was Australia's view, shared by Pacific Island nations, that security should be provided from within the region. We benefit by looking after each other, she said. International Development Minister Pat Conroy said the program would complement Australia's other health assistance measures. This new initiative demonstrates the Australian government is serious about investing in health in our region, the Indo-Pacific, to support more resilient communities, improve health outcomes and save lives, he said. Indonesian Health Minister Budi Gunadi Sadikin said his country appreciated Australia's continuous support. We will continue to work together with Australian partners in the future, to enhance public health capacity and resilience in Indonesia and our region, he said. Senator Wong will also use her Fijian visit to spruik a new Australian visa ballot program announced by the Immigration Minister last week to boost permanent migrant workers from the Pacific. From July, 3,000 places a year will become available for eligible participants from Pacific nations and East Timor to be randomly selected and given the opportunity to apply for a permanent Australian visa. But Senator Wong said the government wanted the program to benefit both Australia and the Pacific region. She said the government would work with Pacific nations on the design and arrangement of the scheme to ensure workers were not drained from places they were needed. We want this to work for everybody, Senator Wong said. This initiative seeks to support gender equality and women's empowerment, disability inclusion, and address the health impacts of climate change. Quotes attributable to Minister for Foreign Affairs, Senator the Hun Penny Wong. Improving the health and well-being of communities across the Pacific and Southeast Asia is critical to ensuring our region's security, prosperity and stability. COVID-19 has reversed health and development gains in our region, and Australia is working with partners to restore their health systems and build on investments made during the acute phase of the pandemic. Quotes attributable to Minister for International Development and the Pacific, the Hun Pat Conroy MP. This new initiative demonstrates the Australian government is serious about investing in health in our region, the Indo-Pacific, to support more resilient communities, improve health outcomes and save lives. This initiative will complement Australia's ongoing health assistance in the region, through support to partner governments, multilateral organisations, and non-government organisations.